হ্যালো, এখন শুনতে পাচ্ছ তোমরা?
জি স্যার।
হ্যাঁ, এখন
জি
ক্লিয়ার?
স্যার, আসসালামু আলাইকুম স্যার।
ওয়ালাইকুম আসসালাম। এখন ক্লিয়ার?
ইয়েস স্যার।
আচ্ছা, হ্যাঁ বুঝতে পেরেছি। ওই রুমে একটু নেটওয়ার্ক বোধহয় দুর্বল ছিল, এই রুমে আসাতে এখন ঠিক আছে। এখন শুনতেই পাচ্ছ না?
জি স্যার।
ওকে, আমরা কি শুরু করবো নাকি আরেকটু ওয়েট করবো? মাত্র তো ৭৬ জন। শুরু করে দিই, অলরেডি তো আমাদের ৫ মিনিট ১০ মিনিট চলে গেছে। হ্যাঁ, শুরু করে দিই। বিসমিল্লাহ। হ্যালো।
জি স্যার।
জি স্যার।
হ্যাঁ, ঠিক আছে। তাহলে দেখো, আমরা আজকে শুরু করতে চাচ্ছি ফিমেল রিপ্রোডাক্টিভ সিস্টেম, রাইট? রেকর্ডিংটা স্টার্ট করে দিই। ফিমেল রিপ্রোডাক্টিভ সিস্টেম, এটা as you know আমরা আগেই বলেছি, এটা this has got some parts and these parts are called mons pubis, labia majora, labia minora, clitoris, bulbs of the vestibule, greater and lesser vestibular glands, and these all together are called the vulva or pudendum. So the external genital organs are also called vulva and pudendum, but this term vulva is particularly used for female ones. That means the male external genital organs are also called pudendum, but in general, vulva is particularly used by the laymen or non-medical persons as female genital organs, and pudendum is more used clinically. Okay, so the ordinary the non-medical professionals or people use the vulva for these organs or parts, and pudendum is the medical term like internal pudendal nerve, pudendal nerve. We don't say vulval nerve, right? So we say internal, the pudendal nerve, internal pudendal artery, pudendal block. So all the terms are used in medical arena, the pudendum, and its homologous word or synonymous word is vulva, right? So we'll show them one by one. Next comes the internal genital organs. You see, internal genital organs, if we continue these, is the vagina, then the uterus, then the uterine tubes, and the ovaries. And out of these, as can assume which one is the primary sex organ of the female would be
Ovaries.
ovaries, right? You're absolutely correct because it is homologous with the testis, which is the primary sex organ of the male, and so ovary would be the primary sex organ of the female, no doubt about that. Okay, now I'd li- where are you? I don't see you. Why? I don't understand. Yes, this is where we stand. Okay, so next thing, let us start one by one, and I'll take help of particularly one book, The Clinically Oriented Anatomy by Morse, and some other books like Visram Singh, Indervish Singh, and Arjalast, and also Eke Datta. But starting with, I'd like to introduce today the very nice book. I have already told you it's a very elaborate book. That's why the students don't get time to study. But Moore's Anatomy is a very nice book, as I have shown you, and you will see Moore's Anatomy, where we'll start with the male female reproductive system, the female external genital organs, right? So if we start with the female genital organs, which one is the female external genital organ location? What is the location of these female external genital organs? Who can tell? What is
Perineum.
the location of these organs? In which part of our body these female genital organs are located, external genital organs are located?
Perineum, sir.
Perineum, very good. You have studied, the Tanvir sir has taken the class of perineum. Last week I have heard, and that was a very nice one. And now I would like to mention again that this perineum is a diamond shaped space in the, where it is located, in the lower part of the trunk, below the pelvic diaphragm to the pelvic outlet, right? So
Yes, sir.
externally, these are the things that are present in the male as well as in the female, but now we are going to consider these the female ones, because male ones we have discussed in detail. So now we are going to discuss about the female external genital organs. Starting from here, this is the mons pubis, and this is the labia majus, this is labia minora, and this is the clitoris, right? And this is the vestibule, and in between the labia majora, this part is called pudendal cleft. So the labia majora, the majus is the singular and majora is the plural one. So the labia majora on its side ensheaths or encloses an area in between the two thighs when they are adducted. I'll show you. This area is called pudendal cleft. Pudendal cleft. And the labia, what labia majora is, I'm going to tell later, wait later. And this one is the labia minora on its side. One on each side. So in between this labia minora, the area is called vestibule of the vagina, right? So there are two terms. The labia majora encloses the pudendal cleft, where all the orifices, the urethral orifice and the vaginal orifice is located along with the labia minora, and the labia minora actually encloses the vestibule of the vagina. So this area is the vestibule of the vagina, where actually the openings are. What are the openings that opens into the vestibule of the vagina? Urethral orifice and the vaginal orifice, and the openings of the greater and lesser vestibular gland. There are some glands here. These glands are also have their opening here in this vestibule region, right? So let us consider very little. It is not that much important, but this mons pubis is the part of, it's a fatty pubis. Mons means mountain, and it's a pad of fat just in front of the pubic symphysis, pubic tubercle, and superior pubic rami. This is a pad of fat which actually acts as a cushion during coitus, right? So this is the importance, and that this mons pubis, it gets redundant, increases during the puberty, and it attains its full thickness during the youth, and in the later age it also shrinks, but it only acts as a cushion, and there is some coarse pubic hair here in this mons pubis. That's all. There is no important other than the infection of these hairy follicles. There's no clinical importance of it. It's just a cushion. But this labia majora is very important because these female external genital organs performs three things. In short, if we say what are the functions of the female external genital organs, what would you say? Female external genital organs,
Urination,
what are the functions of it?
urination, and reproductive function.
Reproductive function.
No, sir.
Is there any? Actually, though they are reproductive organs, they are not related to the reproduction. Actually, they have got three major functions. One is the sensory and erectile tissue for sexual arousal in intercourse, and to direct the flow of the urine, and to prevent entry of foreign materials into the urogenital tract. So indirectly, it can help in reproduction, but these are not a must for reproduction. Actually, it acts as sensory and erectile tissue for the sexual arousal and intercourse. And very important one we always forget, it directs the flow of the urine, or else it would have been spread all over and spoiled our dresses and everything, all of the females. And there would be a hazardous thing to do. So it directs the flow of the urine. And finally, it is very important one that it prevents the entry of foreign materials into the urogenital tract due to the presence of these, due to the presence, as you can understand, due to the presence of these labia, majora, minora, and other things. Straightway, nothing can enter without the hindrance of these, because they are not patent. When we stand, the females stand up. I'll show you the picture. These are not open. They usually remain opposed, so things can't easily enter into the female genital tract without passing through these labia majora and minora barriers. So this is also an important function, right? Okay. So if we continue a bit more about labia majora. Actually, this is a fold of skin in anterior fold and posterior fold. Is a thick fold of skin. Is a plenty of on this skin. There's plenty of sebaceous glands, hair follicles on the outer side, but inner side it is pinkish and without any hair follicle, only covered by the mucous membrane. Got it? So on the outer side there is some hairs. These are shown by these lines. Plenty of sebaceous glands, which makes it, lubricates it, and also the inner surface is free of the hairs but is covered by mucous membrane, and that's why it is pinkish. And this labia majora unites to the anteriorly or superiorly to form the superior labial commissure near to the pons pubis, and inferiorly near the anus. Actually, it unites again to form the posterior labial commissure, which actually disappears after the first intercourse, and it usually becomes flat then. Okay, so this is about the labia majora. And now come to the clitoris. Clitoris, as I've told you, one thing, the labia majora is homologous to the, most of us will discuss about this thing, what are the homologous structures of the female genital organs with the male one. So you know, the labia majora is continuous or comparable to what structure in the male, of male? Who can tell?
Sir, scrotal sac.
Scrotum, sir. Scrotum.
Scrotum, very good. But the only difference is that scrotum has the median raphe where two sides have united, joined together, but in case of uh, labia majora, they are apart. Now, the round ligament of the uterus, you can see from this figure. So this is the round ligament of the uterus which has joined the labia majora, right? So this also has attached the, we know that idiot. There's a round ligament of the uterus which has an attachment, inner attachment to the uterus, and another attachment to the round. We have studied it in the content of the inguinal canal or other areas, that it comes to the scrotum in case of male, and in case of female it is attached to the labia majora. So I'm going to show you some sexually explicit figures, but you are medical students, so you must see and be habituated to these figures, because you have to deal with real life patients in your third year, fourth year, and time to come. So you can see this is the anterior view or standing view of the female genital organs, and this part is called the pudendal cleft, as I have told you. And you can see it's not an open one. The labia majora and the labia minora are actually what they are doing. This is the labia minora and this is the majora. You can see, right? This is the labia majus and this is the minora. So they are closing. It's not an open one. You can see this from this figure, and you can see this figure from here. This is the pudendal cleft, and also it is called lithotomy position. I've seen that sir has shown you the lithotomy position, where for examination and for delivery we use this one. So this is the pudendal cleft, and this is the vestibule. Okay, this is the mons pubis, and this is the labia majora, minora, and this is the vestibule, where this is the urethral orifice and this is the vaginal orifice, right? And now all the feta, if we remove the skin from here, all the fantasies will be gone, and you can see that this is simply, as other parts of the body is, this is simply full of muscles, blood vessels, and nerves. So there's nothing to be afraid of, but when you just remove the skin, it becomes the sheer anatomy. And this third part area is the perineal body. As sir has told you, this is a very important one structure, fibromuscular structure, which contains the attachment of 10 muscles. You know it. So these anatomically, this is the urogenital triangle of the perineum, and this is the anal triangle of the perineum, and this is the perineal body. You can understand? Can you understand this
Yes,
figure?
sir.
Yes. So this is the round ligament, and these are the things that we are now discussing about. Okay. So the labia majora, we have told you, labia minora, that is also told. Clitoris. The clitoris is an erectile, this one is the clitoris, and clitoris is an erectile organ, erectile structure, erectile tissue. It is comparable to the male penis, right? And as the penis has a body and a glans and two crura, similarly, clitoris also has got the body, the glans, and two crurae, which are attached to the ischiopubic ramus. In the similar way. But the difference with the penis is that it doesn't contain the opening for the urethral. In the male, we have studied it in detail. It has got two parts, corpus. Body of the penis has got two parts. What are the parts? Corpus.
Spongiosum or
Cavernosa and
corpus
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 callosum.
spongiosum, corpus
Right,
cavernosum.
very good. Corpus cavernosa and corpus spongiosa.
Spongiosum.
Right, spongiosum. Here only is the corpus cavernosa, and there is no urethral passage for the urethra here. So it is only for the copulation and sexual arousal and pleasure. There's no function, as in case of male. In case of male, the penis is for expulsion of both semen and urine. Here it is only for copulation purpose, right? But this body is continuous with the crux, and this crura of the clitoris is attached to the ischiopubic ramus. So what about the bulb of the penis and the corpus spongiosum of the penis in case of clitoris? Where it would be? What would be the fate of it? They actually, let me show you, they actually remain as the, this is one picture from Inderveer Singh, very nice one. You see, this is the body of the clitoris, this is the glans of the clitoris, and these are the two crura. Crux is the singular, and two crura are attached to the ischiopubic ramus. So the bulb of the penis, that means it is not told like that. The bulb part and the corpus spongiosum of the clitoris is regarded as a bulb of vestibule on each side of the urethral and vaginal orifices. So this is the bulb of the vestibule on its side. It's a pair of erectile tissue remaining on each side of the urethral and vaginal orifices. These are actually the modification of the bulb of the penis and corpus spongiosum, right? So you can understand. And at the posterior end, just in front of the perineal body, there are two glands. These are called greater vestibular gland of Bartholin's gland. And these Bartholin glands are not that much important unless there is infection. And if it is infection, this is a very dangerous one. And it can spread the infection. This is the Bartholin cyst. It is a normal anatomy, you can see. But when these Bartholin glands have been infected and form cyst, it can even close the vestibule fully, and it is a common source of cancer of the female. So you must remember, this is a common source of cancer for the female. This Bartholin gland cyst converts into cancer if it is a long-standing one and not treated. So then it becomes very important one to know. But otherwise, it's as normal as it is, as this picture is. You can't see them normally. Okay, as we are told about the Bartholin's gland or the greater vestibular gland, there are some other glands called lesser vestibular glands or Skinner's gland. These are two glands, Skinner's gland, which are homologous to the prostate of the male. They are located around the openings of the urethra. So this is the urethral orifice. Around this urethral orifice, there is two openings of the Skinner's gland or lesser vestibular glands, which are homologous to the prostate of the male. And these two Skinner's gland secrete some antibacterial substances, also some lubricating substance like the prostate. That's why they are regarded as the homologous part of the and lubricates the secretion, right? So these are the location of though it is not shown here, but have an idea. So these are the greater vestibular glands, and there if it were here shown, it would have been located somewhere around the urethral orifices, the lesser vestibular or Skinner's gland. So this is in short about the external features. And now one thing, this is the urethral orifice, which lies 2 to 3 centimeter anterior to the vaginal orifice, and this vaginal orifice is actually continuous internally with the vagina that continues with the cervix of the uterus that we will study a bit later, right? So let me tell you a bit more about these two things, the myth regarding the clitoris and the myth regarding the hymen. In Middle East, hello, is anyone there? Okay, in Middle East countries, it is these hymen. What is hymen? Hymen is simply a mucous membrane which partially closes the vaginal orifice, and it is actually ruptured during the first coital intercourse. Normally, it is believed, and it is super emphasized, highly emphasized in the Middle East countries, Arabian countries particularly, and they, in the first night, usually after marriage, they put down a white towel and see whether the female, the partner has made it red. If it is not, then she is regarded as a not she is not of a good character, and sometimes the marriage breaks. And if it is okay, then the next day the Arab male on the tip of the sword shows that red towel to show his bravery and the winning over the girl. So what happens that as this happens, the senior members, female members, usually supplies some blood of other animals, like other animals, so that the female partner, if it is not bleeded normally, she can wet the towel with this blood and get rid of the situation. So you can understand how much emphasis is given on the this hymen myth. But actually there is no study, formal study. Only one study has been we have found so far is the British Medical Journal of Medicine. There we have seen one study in 1998, and that study shows that at least 63% of the female don't bleed during the first intercourse due to the rupture of the hymen. At least 63%, even more, because some can't remember. Right, Sandeep? So this is the overemphasis on this hymen, because even without intercourse, the hymen can rupture. Say you do gymnastics, or you ride on horse, or you do laborious things, the hymen can rupture without intercourse. But this is one myth that has been added to the concept of virginity, and that is not a true one and correct one. Another one is very heinous and very brutal thing is the circumcision of the female, that is particularly done in the African countries and the Middle Asian countries, where the glans clitoris and sometimes the crura of the clitoris are circumcised roughly and very roughly, so that the female don't have the arousal, okay, and remain confined within the houses. So this is illegal throughout the world nowadays, and if someone does it, it is punishable crime nowadays. But still, it is going on in some parts of the Africa and Middle East countries. So this is another very heinous thing that has been done, going on, the female circumcision of the clitoris. Okay, now the study of female genital organs, external genital organs, is not complete. Oh yes, this is the skin is gland picture, where you can see this is the skin is gland, and this is the urethra. I've told you it is around the urethral orifice opening, and this is the vaginal opening, you can see, and this is the location of the Bartholin's gland. So this is the Bartholin's gland, this is the skin is gland, this is the urethral orifice, and this is the vaginal orifice. Okay, and this is the lesbian minora, and this is the majora. This one is the majora. Okay, now one thing I want to stress is these muscles. The study of the female external genital organ is not complete unless we study these ischiocavernosus muscle. Ischiocavernosus muscle, you can see it, and the bulbous spongiosus muscle, and the superficial transversus perineum muscle. These three muscles, among these, the ischiocavernosus and bulbous spongiosus muscles actually help in erection of the clitoris and the maintenance of the act of copulation, and the sexual arousal and the act of copulation is maintained by these two muscles, as it is very important in case of male. As I've told you, Kegel's exercise is also important for male. Have I told you about Kegel's exercise?
No, sir.
No, sir.
Kegel's exercise?
No, sir.
না স্যার বলেন
No,
নাই।
No.
sir.
বলেছিলাম?
না
No,
স্যার।
sir.
মনে পড়ছে না স্যার, এরকম কিছু
Yes, sir.
বলেছেন
I know
কিনা।
little much about it.
আচ্ছা, this
Sir,
is
it
very
makes the
important
pelvic
one.
muscle strong.
So muscular tonicity বাড়ানোর
Yeah,
জন্য, sir.
but it is a
Healthy diet.
right. It's very good. And if you go and search, you'll find in Google apps the Kegel's exercise app. This is so much common that they have made apps for Google exercise, like the six-pack abs or the muscle abs apps for the biceps. Similarly, Kegel's exercise apps are there because each and every female of reproductive age in the Middle European or developed countries are taught about this Kegel's exercise. And not only it is a must for every woman who are expecting or are pregnant. They must know and make sure that they can do this Kegel's exercise properly. Why? Because this Kegel's exercise strengthens our ischiocavanosus IC muscles. They say IC, ischiocavanosus muscle, and PC, pubococcygeus muscles. These muscles are strengthened by the Kegel's exercise, and that helps in maintaining the or increasing, but because these muscles are strong in male, very strong in the ischiocavanosus pubococcygeus muscles are very strong, so strong that they can drag the ischiocavanosus ischiopubic ramus to the interior, that is everted. You have studied, due to the pulling of these strong muscles, the ischiopubic ramus comes to the middle side due to the pulling. But in case of female, they are not normally so much developed. But during pregnancy, if someone practices these transversus perineal muscles become strong, and that helps in prevention of prolapse of the genital organs, like the prolapse of the uterus and other things. After delivery, all these things are lax, so uterus tends to prolapse, and that's why this Kegel's exercise in case of female helps in preventing the prolapse of the uterus, and in case of male, it helps in preventing the premature ejaculation. That is a very common and unshareable problem of the males, the premature ejaculation. But that can be easily solved by this Kegel's exercise, and because it helps in strengthening of the pubococcygeus and ischiocavanosus and superficial transverse perineal muscles. So how do one has to do that? It's very simple. Nobody will understand how Kegel's exercise is done and when it is done. Simply, this is, let me tell you, the girl students, are you there? You must know this, and you must tell it to your patients, and also the boys, because of different reason the premature ejaculation is a very common problem of your patients, and also you can share it with others. But that is very simply done. You sit quite calm and consider that there is voiding, urination is done, going on, and you try to stop the urination. For the first time, you have to do it in your toilet, sitting on the commode or some anyhow. With the micturition is start the micturition normally. You'll tell your patient to start the micturition normally, and then stop the micturition by the willpower. By the willpower, you have to stop the micturition. A running micturition has to be stopped by willpower, and you'll feel that these just behind the vaginal orifice and in front of the anal orifice, there will be a contraction. Now you can understand that is the contraction of the perineal body. But the common people will not understand. You'll say that if you are female, you'll feel a contraction. If you can stop your micturition by willpower, not by males by holding the penis, but by willpower, if you can stop the micturition, you will feel and identify that there in between the in front of the anus, in case of male, there would be a contraction, and in case of female, in between the vaginal orifice and anal orifice, there would be a contraction and hard feeling, firm feeling. That is the perineal body. Now you understand, but they will not understand. Just tell them that you will feel that there is a hard feeling or firm feeling in the this region. And now it is over. You go on with normal micturition. Next time you sit normally on the chair, not in micturition, just normally, and try to contract that muscle. Try to contract that muscle by your willpower, not during micturition, anytime for 6 seconds. Not, don't do this, overdo this. And also make the precaution to the patients, don't overdo this. 6 seconds, then relax for 6 seconds, and do it 6 times. This is one set of Kegel's exercise. Repeat it at least 3 times a day, and that is the, but don't overdo it. If you overdo it, this ischiocavernosus and the pubococcygeus and the superficial transversus perineal muscle will be rather weakened due to the over contraction, and the situation will worsen. Instead of getting benefit, the patient will be having the situation worsened if they do it repeatedly and for more time than 6 seconds. So very simple. Contract it, hold it for 6 seconds. 1, 2, 3, 4, 5, 6. Then relax it for 6 seconds. 1, 2, 3, 4, 5, 6. Can do it 6 times, and that is one cycle. And repeat it 6 times. That is complete for one morning. Then do it in the afternoon and night. That's all. And this will help to build up these muscles, and that will help to prevent the collapse or prolapse of the uterus. And in case of male, it would be very much helpful to treat the premature ejaculation problem without any drug and without any notice of the others. You're just sitting and doing the exercise in your mind and in your body, that is the perineal body. Okay, so let me finish up today's class. In the next class, we'll be starting the uterus. Vagina is very okay. Vagina is let me finish up the vagina, then we'll be going to the next class tomorrow at same time. So vagina is what? It is the continuation from this vaginal orifice to the inside, right? So what are the parts of the vagina? What are the parts of the vagina? And this is one important thing, pudendal block. This is commonly done because when a baby is born, when a baby is born, it passes through this natural birth canal, and the vagina is what contains the fetus.
স্যার শুনতে পাচ্ছি না।
নেট ডিস্টার্ব হয়েছে।
হ্যালো স্যার। স্যার ডিসকানেক্ট হয়ে গেছে।
ক্লাস তো শেষ।
ফয়সাল ব্রো, তুমি কি শেষ করে দিবা?
স্যার কি মিটিং এ আছেন?
না স্যার ডিসকানেক্ট হয়ে গেছে। ফয়সাল হোস্ট।
ফয়সাল ব্রো তুমি কি আমাদের টোটালি ডেমো দাও? এ আমি হোস্ট নাকি কি কয়? কোথায়?
হ্যালো,
আসসালামু আলাইকুম স্যার।
বলছিলাম কি কাণ্ড দেখো আজকে এত ডিস্টার্ব করছে যে ক্লাসটা। হ্যাঁ আচ্ছা ঠিক আছে আমি দেখছি। So reduce the pain এখানে কি করা হয়, what we do, we insert an injection with uh, local anesthetics and we just block the pudendal nerve here. Pudendal, how we do it, we pass through the vestibular and press it to the ischial spine, and guided by the ischial spine we just insert our finger along with this. We insert our finger along with this syringe, and when we touch the ischial spine we find the locate it and put the give the injection around our finger, and it actually blocks the pudendal nerve, and there is no pain due to the block of the pudendal nerve. It is very commonly done in gynae department for doing minor operations like episiotomy. Is very important one. Episiotomy. Have you heard this term? Episiotomy.
Yes, sir.
Hello.
No, sir. No, sir.
জি স্যার।
হ্যাঁ শুনো নাই শব্দটা?
জি স্যার শুনতে
এপিসিওটমি।
জি স্যার।
না শব্দটা শুনেছো? এপিসিওটমি পড়েছো? এটা
পড়ছি না, শুনছি স্যার।
পড়ছো কিন্তু বুঝতে পারো নাই। ভেরি সিম্পল থিং। এপিসিওটমি হচ্ছে
মিড
কি
ল্যাটারাল
দেখো।
ইনসেশন।
হ্যাঁ 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 দেখো এই যে আমাদের এখানে তো কি আছে, এই যেখানে আছে কি এখানে আছে perineal body. If the tear, a baby is born uncontrolled, if it is a baby is born on uncontrolledly, what will happen? It will be
Teared.
tearing the perineal body, and if the perineal body is ruptured,
It continues up
then,
to MS.
then muscles will be losing its attachment, so there will be prolapse of the uterine, the uterus and other contents, female genital tract contents, right? So to prevent the uncontrolled rupture of the perineal body, what the gynecologists or obstetricians do, actually the obstetricians during the labor, it is the part of the obstetrics. So obstetricians, what do? They make a planned incision here to cut and to make room for the bigger head than expected. So this is called episiotomy, right? Got it?
জি স্যার।
বুঝতে পেরেছো?
জি
So
স্যার।
to prevent the uncontrolled rupture or damage to the perineal body, the obstetricians make a planned incision here or here. This is called lateral episiotomy, medial episiotomy. So many varieties are there, but that is called episiotomy. You can understand? So this is the due to the episiotomy and other things. Actually, they actually practice the pudendal block. So this is the how inserting the needle along the guidance of the finger inserted along with, and when the finger touches the ischial spine, the needle remains a bit behind, and then the injection is pushed, and that blocks the pudendal nerve. Okay, so this is how the pudendal block is given. Now the vagina. What about the vagina in short? আচ্ছা তোমরা কি শুনতে পাচ্ছো?
ইয়েস স্যার।
আচ্ছা, let me tell you one true story. আজকে ক্লাসটা যেহেতু একটু হচ্ছে আমি শেষ করে দিচ্ছি। I was that was my first posting in Upazila Health Complex, And that time, there's a senior for the foreign students, if anyone is there. It's a Upajala is a administrative small unit where 2 million or 3 million people resides, and 10 to 15 doctors works under the senior one. And the senior doctor requested me to go to attend a call uh, of the union chairman. He's a political leader. Usually they're very much influential. So he told me that you go and attend the call. And I went. And before going, he instructed me, this is, she is a known case. It was a patient, was mother of the chairman, and she was a known case. And just give her uh, some, is a case of bronchial asthma, some give some uh, inhaler and other medicines and should be okay. I went there and I saw that there is no sign of wheeze or nothing, but there is respiratory distress. So I examined and found that there is her eyes are paper white. Paper white. Understand? Paper white means severe. Are you with me?
Yes,
Yeah.
sir.
Yeah. Her eyes are paper white. That means severe anemia. I thought why it would be. And I asked about whether there is a bleeding parectally due with stool. No. Any other bleeding? No. Then I guessed that there would be definitely some bleeding from the genital tract. No blood goes with urine, no blood goes with stool. So definitely. And I told that I have to examine her genital regions, and they all got angry. Why? Why would you want to do this? I will say, if you want to take treatment from me, I have to do that. And after some hot conversations, they agreed. And the wife of the chairman and other females were there. They surrounded the patient and examined, and all of them fell on the floor because it was a huge procedentia that we call huge, big uterus lying outside, and that was rotten, and blood was dribbling from that. Infected pus was dribbling from that, and she was leaving it with these for 40 years. Can you understand? Imagine, she had been with taking and carrying it for the last 40 years. These uterus is completely outside, was completely outside her perineum, and it was hanging, and the blood was dribbling. And she then I found that it was since the chairman's younger brother was born, this happened. And then the chairman's father got married to another woman, and she was neglected, just allowed to remain within the family. That's all. But she has been withstanding with these presidentia for last 40 years. When this was told to the chairman, he was literally rolling on the floor. What happened to my mother? I didn't know. I didn't know. She was saying, so Dr. Shab, what can I do? কি করতে পারি বলেন আমার মায়ের জন্য? I said, one thing you can do, just nothing you can do for to retrieve it or to revive it. You just have to, what you can do for the easiness and the benefit of quality of life, you just can have a hysterectomy. That's all. But not, other things are already done for the last 40 years. So you can't give her that 40 years back. But what you can do for the rest of her life, she would be having a free life if this uterus is hysterectomy. And then he did it. After a few days, he was given blood. He was taken to district hospital and given blood and other measures. And when she was all right, preferably better than before, then she was taken to Dhaka and hysterectomy was done. So why I'm telling you this story? Don't believe on others. You have to have your own confidence and your way of treating your patients. My senior one, THNFPOs, told me she is my patient for the last 10 years. She is a bronchial asthma patient. So if I had followed him, I would have given him the bronchodilators, and that was enough for temporary remedy. But that will not be cured because this is not bronchial asthma. This was anemic heart failure. And due to severe anemia, the heart was failing. That's why she was having respiratory distress. This was not bronchial asthma. So you have to, the second thing that I want to stress, that as a physician, you have to have a detective's mind. So a single small clue, the severe anemia led to the diagnosis of such thing. So this is how you should address your patients. And there are so many good teachers in Dhaka Medical College who would be teaching you the clinical side when you go to the third year bedside near to the patients. And I'll request you to make full use of that things, because Dhaka Medical College is different from other institutes in only one, if not others. The first and foremost thing is that there is a huge branch of great teachers and complete array of patients. So with this combination, you can be a great physician if you want to. So this is my request. Whenever you go to the clinical side, don't waste your time, and don't waste your time in the preclinical side, because this is the foundation for your doing better in the post, third year, fourth year, and onwards learning. Okay, so we can conclude today's class, and in tomorrow we'll be having the, in short, the vagina and uterine tube and ovaries, but mostly we'll concentrate on the uterus. Okay, tomorrow at the same time, and hopefully, inshallah, and testing it before. Okay, thank you.
Thank you, sir. Assalamu alaikum.
Thank you, sir. Assalamu alaikum.
Can I stop the class?
Assalamu alaikum, sir.
Assalamu alaikum.
Walaikum salam. Walaikum salam. Walaikum salam.